Hi, my name's Jim Notero. I'd like to tell you a little bit about our company, Clinical Support Services, the current types of technology that we have developed for care management applications, and why I think that we can leverage that technology for a next generation of functionality for integrated delivery systems, specifically health homes. So first, a little bit about us. We're about a 10-year-old company that's composed of a staff of both IT folks and clinicians. And so we look at this issue of care management from multiple perspectives. We started our life working for physicians who were in capitated environments. So these folks were both at risk for the clinical and financial risk of their patients. And what we found is that they needed an infrastructure that allowed them to do high volume care management that was both reliable and systematic. And so what we developed is a database that decomposed the clinical chart into discrete queryable elements. A little bit more about that in a bit. And then we developed a functionality that allowed us to incorporate large volumes of administrative claims information, both medical and pharmacy, into the patient's record. And finally, over the top of that, we layered an interface that allowed clinicians to access that data for management and monitoring purposes. And so let's talk a little bit about this idea of discrete clinical information. So the best way that I can think of describing this is from an EKG perspective, a waveform, a graphic waveform that we all know very well. And so if you think about this waveform, when you store it in the patient's chart, whether it's the old form paper chart or even the newfangled EHR, it's stored as this graphic blob, and you can't query it to apply decision analytics. And so with Clinical Support Services, what we've been doing is we've been working to take this graphic waveform and break it down into the elements that a clinician might use to apply decision analytics and determine what the patient's next care path might be. So at Clinical Support Services, we've been looking to do this not only for the very discrete elements of the clinical chart, things like labs and diagnoses, but also for the more subjective parts of the clinical chart, like a depression evaluation, something that is generally very subjective and based on the particular clinician that's doing it. From a clinical support perspective, what we've done is we've created a depression evaluation rubric. So if you answer a series of 8 or 9 questions about the patient, you could come up with an evaluation of their depression status. And if you save this record to that patient's chart, then what you can develop is a longitudinal assessment of that patient's depression status. And so to this longitudinal assessment of the patient's status, you can apply decision analytics to determine what might be the next point in care for this particular patient. The other distinguishing feature of the Pathfinder system is the idea of care tracking. So we think that care management has 3 basic components to it. There's a patient assessment, where you bring together the essential elements of the patient's information to create a profile, a patient profile. And then you take that profile and you resolve it into a series of recommendations or a care plan. And then at some point in the future, you have to resolve those recommendations, determine what worked, what didn't work, what was accomplished, what wasn't accomplished, so that you can go on to reassess the patient, conduct another patient assessment. And this cycle has to be done on a regular, systematic basis. And so we've built that into a work queue where every patient is tagged with a follow-up date and no patient falls through the cracks of care. A system where the system is thinking about the patient when they aren't necessarily thinking about the healthcare system. So how would this work from a care management perspective? Well, if a patient had a pending assessment in the work queue, the system would take you directly to that assessment. And when you open up that assessment, you would be asked to evaluate the patient, both from a subjective perspective, interviews with the patient, evaluation of the patient, an objective perspective, things like diagnoses and lab information. And that information would come together to form a profile of the patient, the assessment. And then that assessment could be used to apply some decision analytics and create a care plan for the patient. And so you'll notice that in this care plan, the profile of the patient is being analyzed by the system to understand that there's a drug interaction. And if we decide that that drug interaction is significant, we could make a recommendation about that interaction that could be saved to the patient's chart to provide a component of the care plan. Now, accessing this data is done through a series of portals. We have a general care management portal, our EMR Path portal, and that provides a generalized environment for care management. We have specialized portals, realizing that different types of clinicians will want to do care management. So one very specialized type of care management is medication management. And so we've designed a pharmacist-based portal for looking at the patient's medication regimen from a care management perspective. Now, not only providers are going to want to look at the patient, but also patients are going to want to look at this patient information. And so we have a patient view, PMR Smart, which is our personal health record portal. And a patient can log in and look at their thin slice of the clinical information that's been attributed to them. And finally, we have a community portal, which looks at this information from a community perspective. What's the quality of care, for example, that's being delivered to the patients? So how would we configure these portals for a health home or an integrated delivery system in general? Well, all of the patients belonging to the health home would be in the Pathfinder registry and would be assigned to a lead health home. That lead health home could reassign patients to one or more health home partners or health home providers. The health home providers working through one of our portals could interact with a RIO, for example, to get information from other healthcare providers in the health home, could interact directly with a care manager or another type of provider that had their own EHR or case management system. And because there's a substantial amount of clinical information that's still stored in patient records, the Pathfinder portal has document management capabilities so that providers can still interact with patient paper charts. In addition, insurance partners in a health home will want to provide pharmacy and medical claims. And so with our data path functionality, we can load big batches of pharmacy and medical claims and attribute them to a patient registry. And other organizations like RIOs are starting to mark data like lab results and imaging results, which can be loaded in the same way that medical and pharmacy claims are through the data path functionality. So in this vision of a health home, we have an interesting dynamic where multiple health home partners can view one patient all at the same time, causing the potential for either missed care when providers assume that another provider is delivering necessary care, or duplicate care when providers are trying to provide the same care to the patient. And so one of the things that might be critical to care management in an integrated delivery system is the idea of a master care plan, which is what clinical support services would like to produce in the accelerator program. The master care plan, from our perspective, would incorporate data from across the care continuum to produce a dynamic patient profile, a profile of that patient at that particular point in time. And based on that profile, provide a dynamic set of care management alerts which could be converted to the components of the care plan, the care recommendations. We envision our care plan as having three major components: the patient profile, all the data from all of the providers who are currently caring for that patient, the care required for that patient, so the system-generated recommendations of care based on that profile, and then finally the care in process, care which has already been initiated for that patient so that we can prevent duplications in care. Now, one of the reasons that we would like to try to produce this type of care plan in the accelerator program is because we think that we have enough existing functionality, what we might think of as first generation technology, our discrete data elements and our workflow technology that could be leveraged in the accelerator in the short time that the accelerator program provides to produce competent functionality for integrated delivery homes and health homes in specific. I hope that I've done a compact and succinct job of explaining to you clinical support services, our existing technology, and how we might leverage those to produce the dynamic master care plan. Thank you very much.